Hello everybody, welcome to a new video. Today I'm going to be talking about COVID and how it has affected me and my family. This year our world has changed in a big way. Nothing will ever be the same. Everything we do in our day-to-day lives has been changed, maybe forever. Shopping, running an errand to the bank, going to your local corner store, going to the post office, seeing a doctor, going to your local hospital, family trips, holidays, even school has been affected by COVID. As a homeschool mom, I like planning field trips throughout the year, as well as gathering with other homeschoolers and family trips. These have all been affected dramatically this year. I have canceled many field trips this year because of places and museums being closed. Because we were put under a lockdown and were not allowed to leave unless it was necessary, for a good part of the summer, even playgrounds were shut down. Parents were getting fines and even arrested for taking their children or child to the playground. One father who took his kids rollerblading was fined almost $1,000. I'm going to show you a little clip here and leave a link in the description.
Would you have given a ticket in those circumstances, or?
I cannot comment on those,
Okay.
because each case is different, right?
Okay.
So we don't know. It's not my evidence, so I cannot comment on those at all.
David Menzies for Rebel News here in Oakville, Ontario. Well, folks, on Good Friday, Oakville resident Todd Nelson took his 3 young children inline skating here at the Glen Abbey Community Centre. And they were having a fun time, and why not? The parking lot is completely empty because the community center is not in operation during this day and age of the coronavirus. However, within about an hour, someone came along who happened to be bylaw enforcement, and well, we weren't privy to the conversation, but I don't think it went well. Mr. Nelson, the bylaw officer demanded he show his identification, and the next thing you know, he had a ticket for $750 plus surcharges, bringing the grand total to $880, or in other words, precisely $220 per skater. Now,
It has affected my homeschooling. Many homeschoolers have been affected this year. The government cutting funding to independent distributed learning schools, millions of dollars taken from schools that support and provide a service to homeschoolers. I covered this a couple months ago in a video called Homeschool Funding Cuts. I will leave a link in the description of this video if you want to check that out. For a large part of the year, there has been a ban on social gathering, and now we are only allowed a circle of 6 people outside of our families. The government likes to call this our safe 6. This has affected my family and many other families getting together with loved ones and getting together with other homeschoolers for fun activities. Another thing that has been affecting in a big way is shopping. Shopping has been affected with restrictions at the grocery stores that have been put in place so they can stay open. Shopping for a portion of the spring and summer involved waiting in a long line outside the store just to get in. There were stores that didn't let parents in together or allow parents to bring their children in the store with them, which caused a big problem for a single parent and a mom or dad that had no other choice but to bring their kids with them. Moms that brought their babies into the store to do grocery shopping were given dirty looks and bashed on social media. Some parents had no choice, and keep in mind at this time there was restrictions and we were not allowed to see anybody outside of our household. So we couldn't have a babysitter or grandparent watch our children while we had to go do grocery shopping. So if you need to get grocery shopping and you're a single mom or a single dad, or maybe your spouse is working, what were you to do? The only choice you had was to bring your children or child into the store with you, like most of us do all of the time. Because of the lockdowns and restrictions, schools and daycares were also closed down. So sometimes parents would take the opportunity while their child was at daycare or at school to do the grocery shopping and errands then. But that was taken off. That option was taken off the table as well. So what were parents to do? We couldn't leave our children with a babysitter or a grandparent. Schools and daycares were closed. So if we were needing to grocery shop and we're a single parent or a parent with a spouse that works a lot, what were you to do? You had no choice but to bring your children with you to the store where you would be given looks and criticized. Many parents lost their jobs because of the fact that schools and daycares had closed. The changes that have come from COVID made my last trip to the grocery store very stressful. I have to already deal with the struggle of shopping while in my third trimester. Most of the time I have my toddler and my 1-year-old with me. And any mom knows how difficult it can be to shop with little ones with you. I had to add into the equation new rules that the store had to enforce to keep open so people could continue to shop. My last trip to the grocery store was to a superstore. Now, I've always had things I did not like about superstore, but I shopped there because of the deals and to bulk buy. Now it is so much harder for a parent to shop there. Now it's so much harder to shop there if you use reusable bags, because they put into effect a new rule where you couldn't set the reusable bags on the belt at the end to bag up your groceries. So what I had to do was I had to set the reusable bags in a line on the floor and bend down and fill them up as I sorted my groceries into each bag. And then I would take the bags and organize them into the cart. It would have been okay to put my bags in the cart and fill them up if I only had a few things. But I had 2 carts worth of groceries, and I had to bag over $1,000 worth of groceries on the floor while I was tending to my baby and my toddler. I'm not blaming the grocery store, because they're only trying to do what they feel they have to so that they don't get shut down or fined. But the fact that I couldn't set my bags on the end of the belt to bag up my groceries, while all of these products that I had just touched went through the cash and were sitting on this belt. The cashier had touched them all. Any person that had gone through the store and maybe picked up one of these products and looked at it and then put it back on the shelf had touched it. The people that stocked the shelves had touched it. You have no idea how many people would have came in contact or breathed on these products. So that is why between every customer, the cashier is supposed to wipe down the belts. So to clean off any germs that might be on the belts after you've used them. Which I understand that they're doing that because of a precaution. But knowing that they were going to wipe down the belt after I finished bagging my clothes or bagging my groceries anyway, they still did not let me put my bags up there to bag my groceries. Like, they don't bag them for you at Superstore. So the cashier wouldn't have come in contact and touched my bags because they don't bag your clothes whether or your groceries whether you use plastic or reusable. So only I would have touched my bags, and afterwards she would have wiped the belt down like she's supposed to. But knowing all of this, they still did not allow me to put the bags on the belt so I could bag the groceries. I had to bag the groceries on the floor. Some of these rules that they put in place do not make any sense and are just there to make the person that's doing the shopping have a harder time. It's almost like they don't want you shopping in the store. I have been getting so many emails trying to get me to switch over to online shopping. But if you're somebody like me that goes into the store with coupons, looking for deals, wanting to compare prices, shopping online doesn't work. A lot of the times, there's problems with online shopping. Something's not there, they have to substitute it, so the lady comes out with all of these things that you didn't even want, just substitutions. And you're paying for this service. Now, I prefer to do my shopping in the store so I can compare prices and I can get exactly what I need and how much I need. No person that works at a grocery store wants to fill a $1,000 to $1,500 order. That is a huge order. It took me 2 carts. Luckily, I had my oldest with me to help me push one of the carts. So, it's not a very good option for me. I prefer to go in the store. So, I don't agree with how hard Superstore makes it for a person shopping. Like, I never liked the fact that I was bagging all of these groceries and dealing with kids, but I always dealt with it for the savings, and I understood that that was their policy and accepted it. But now the fact that I can't bag on the belt, I have to bag in my cart or on the floor, is just making my shopping trip that much harder and is a pointless thing to do since all these other products have touched the belt as well, along with my hands, along with the germs from anybody else that had touched these products. That's why they wipe down the belts. So I could have bagged my groceries on the belts, and then she could have wiped it down to disinfect it for the next person. Another thing, when you go to places like banks or restaurants, you have your phone number and name written down on a list that they leave open for anybody that walks by to see. I can show you a clip to prove that these lists are just lying there open for anybody to look at. When if you have a child that goes to a sporting event, like a game or practice, only one parent is allowed there. Our rights are being taken away, and we are being told if you don't like it, stay home. The even sadder thing I am seeing since the pandemic began is the harm it is causing on people, not by the virus itself, but by the rules the government is putting in place. People in senior homes are not being cared for properly and have lost all contact with loved ones, their sons and daughters, grandchildren, have contact with their loved ones cut off. Nurses have walked off the job because of fear of getting the virus, and seniors have been left in soiled diapers for weeks, neglected and sometimes left starving, in pain and afraid. When these seniors die, they blame it on COVID, but how do we know that it's not from the neglect of treatment they received, the neglect of care, the isolation they had been put in because they aren't allowed their children to come visit them? People with life-threatening diseases being turned away because of government shutting everything down because of COVID. There was days the hospitals were empty because they were not treating anyone. They postponed surgeries, treatments because of COVID. The people that were in the hospital for emergencies were not allowed loved ones by their sides. Pregnant women were forced to go into labor alone. People not allowed to say goodbye to their family members that were dying. The sadness that has come from the virus, where you have a 99% chance of survival, is unreal. Most people that have an underlying health condition had a 10% chance of fatality from the virus. That means there's a 90% chance of survival even if you have a health condition. And that number comes from one of the government websites. They lock down our country with only a few cases, but tuberculosis kills millions every year and nobody talks about it. H1N1, the swine flu, was a fatal disease and there was no lockdowns when it was going around. Every year, millions get the flu and thousands of people die from the flu in the US alone. But we don't shut the world down. Why did they shut down the entire country over a few cases? How can we be sure all of the COVID deaths that were reported are really from COVID when we have so many people saying their parents died from cancer and it was marked down a COVID death? Or someone's family member died in a car crash and they marked it down a COVID death. The list goes on. Many health officials are speaking out against the government and what the government is telling us about the virus. I myself know of a doctor and lawyer fighting what the government is doing and knows that we are being told a lot of false information. Something I have had to experience firsthand since the pandemic started is the struggle to see a doctor. When this started, if you wanted to make an appointment with your doctor, you had to have a phone appointment. Back in March, when my daughter had a rash, I wasn't allowed to bring her in. I had to send a picture of the rash to my doctor and have a phone appointment to discuss what it was in treatment. That is how my interaction has been with our family doctors since March. When I found out I was pregnant, I had to find a doctor for the pregnancy. And most of my appointments with the doctor that is dealing with my pregnancy have been over the phone, except for a few that I went in to get a checkup on the baby. When I did go in to see the doctor, I had to wear a mask in the waiting room, but that changed my last appointment. I was not allowed to sit in the waiting room. They were given new rules by the health officials that people were not allowed to wait in the waiting room. They had to wait in the car and do the first half of the appointment. These are prenatal appointments. We had to do the first half over the phone. And then once we did all of the talking part of the appointment, I would go in and get my heart checked, or my heartbeat checked, or my heart rate, and we would listen to the baby and make sure the baby was growing at the proper speed. My doctor was just as irritated by these rules she was forced to follow as I was. It doesn't make sense where I cannot talk to her in her office, but I can go in for the portion where she does her routine checks. My doctor is told she has to make her patients wear a mask, but that same day after my appointment, I went to the hospital for blood work. I did not have to wear a mask to enter the hospital. I sat there for hours waiting for my turn, for my number to be called. So I can go into the hospital, get blood work done, be around all kinds of people, and not have to wear a mask, and can sit there for hours in a waiting room. But I can't go to my doctor, that's dealing with my pregnancy, and sit in her waiting room. I can go to the grocery store with hundreds of other people, but I cannot sit in my doctor's waiting room. I cannot sit in my doctor's office and talk about how the pregnancy is going and any questions I might have. I had to go to a special clinic for my ultrasounds where I had to wear a mask, and before you enter the building they take your temperature. I had an emergency ultrasound a few months back where I had to go into the hospital to have an ultrasound to check up on baby. I didn't have to wear a mask, and they didn't check my temperature. The restrictions and rules for private practices here are stricter than the hospital itself. The pressure that they're putting on doctors that own private practices is making it harder for them and their patients. And the hospitals don't have to follow these guidelines. There is such a double standard going on right now. You would think that the hospitals would have all of these rules in place if they were making other practices do it. I worry about how things will go when it is time to give birth. The new rules that they will have put in place. All of this stress that they're doing and putting on people like me and my doctors is not good for us. It's not good for pregnancies. Being under stress is not healthy for a pregnant woman to be under. It's not good for the woman, and it's not good for the baby. I am worried about the rules and what they will be when it's time to have this baby. I am more worried about that than I am the virus. I had a discussion with my doctor, the doctor that's looking after the pregnancy, about masks. She gave me a medical exemption because of certain conditions in my pregnancy. She was telling me how dangerous it is for a person to wear a mask for a long period of time. The Government of Canada's website even states this. They state on their website, the use of surgical type masks by individuals without symptoms of cough or sneezing is not recommended. It may actually increase the risk of self-contamination and risk of infection. But at the same time, we're being told we have to wear a mask even if we're healthy. My doctor knows that this doesn't make any sense and shouldn't be recommended. But why are we being forced to wear masks? Why are politicians pushing something like that if it's dangerous? People do not even use masks and gloves properly. They are constantly touching their face to adjust their mask after touching several things contaminating their mask. Wearing a mask for a long period of time has been proven not safe because you are breathing in carbon dioxide, which can lead to other health issues. The government knows this and is still trying to enforce mandatory masks, and it seems like they are going to try to enforce mandatory vaccinations, which goes against our human rights. We should not be forced to take any medication or treatment that goes against our religion, and forced treatment is a violation of our human right. The vaccine will be untested, and we have no way of knowing any potential long-term side effects from these vaccines. We are watching our government step way over the line with control. Right now, we are at risk of the government putting in place another lockdown. What is that going to do to our economy? How many more people will lose their jobs? How many more people will suffer medically, financially, because of another lockdown? More people will suffer and die because of another lockdown than from the virus itself. More harm will come from a lockdown than from COVID. How many rights are the people willing to give up before people start saying enough? The government is already putting into place quarantine facilities to quarantine people indefinitely, if they see fit, with very vague guidelines on what qualifies a person to be put in a quarantine facility. They have already passed these laws. Here in Canada, when under a pandemic, the health officials have power to make and have laws enforced. I'm going to show you a clip of these laws being discussed in Parliament.
Next question, the member for Lanark, Frontenac, Kingston.
Thank you, Speaker. My question is to the Premier. In my supplemental question yesterday, I asked this government if the people of Ontario should prepare for internment camps. In September, the federal government posted a call for expressions of interest for contractors to supply, provide and manage quarantine isolation camps throughout every province and every territory in Canada. These quarantine isolation camps, however, are not limited to people with COVID, but provide a wide latitude for many people to be detained. Surely this government is aware of the intentions to build these isolation camps from coast to coast. And my question to the Premier is, how many of these camps will be built, and how many people does this government expect to detain?
Question. Government House Leader.
Thank you, Mr. Speaker. It is very true that when people leave the country and when they come back in, that the province is suggesting, and the federal government, in cooperation with the federal government, we are suggesting that people isolate themselves. That has been a practice that has been very successful, not only here in the province of Ontario, but across Canada. And we will, of course, be redoubling our efforts to make sure that the people of the province of Ontario remain safe, Mr. Speaker.
Here's the RFP. And in the RFP, it uses clear language to express that these camps can be used for a broad spectrum of people, not limited to travellers. Indeed, it doesn't even mention international travellers. It's just a broad latitude of people. And I'll send over the copy of the RFP after. So your government must be in negotiations and aware of these plans to potentially detain and isolate citizens and residents of our country and our province. So, Speaker, to the Premier, where will these camps be built? How many people will be detained? And for what reasons?
Question.
For what reasons can people be kept in these isolation camps? And I'd like to have the Premier assure the people of Ontario.
Member, take a seat.
Wow, that's something. I think for Mr. Hillier's first question, the answer was evasive, to be kind. For the second question, there was no answer. They just cut it off.
Warning, censorship. Warning, censorship.
Cian Bexty for Rebel News, standing in rural Manitoba, standing in a place at a location you probably wouldn't even notice if you weren't looking for it. This is a COVID camp, one of the ones that the CBC doesn't want you to believe exists. In fact, article after article coming out of the CBC and every other mainstream media site, but particularly the CBC, who is running damage control for Justin Trudeau, they say that no sites like this, now they're not real, they don't exist. Justin Trudeau, of course, put out an RFI, a request for information, asking for industry to give them input, give the federal government input onto how they could best run camps just like these. And apparently they've set up a few already. Now, this camp in particular is run by the Manitoba Métis Federation, and it is currently standing empty, according to a conversation I had with two folks who are running maintenance here. Now, they weren't wearing any masks when I was talking to them, so I tend to believe them that there's no COVID cases in here right now, but I'm also curious as to what the purpose of these camps are, especially when it comes to Justin Trudeau's camps. The RFI states that it's for health purposes and for dealing with the coronavirus pandemic, but it also says that people can be added to the roster of these camps' clientele for any other requirement that the federal government has. What are those requirements, and why is the CBC so concerned with you knowing that camps like this already exist?
What are your thoughts about this year and how your government is handling it? Where do you stand on mandatory masks and lockdowns? Let me know what you think about all of this.